How to prevent a heart attack. Heart disease is the leading cause of the death in the United States. It is also a major cause of disability. There are many things that can raise your risk for heart disease. They are called risk factors. Some of them you cannot control, but there are many that you can control. If you're interested in learning about these preventions, then please keep watching. Risk factors you can't change. Age. Your risk of heart disease increases as you get older. Men age 45 and older and women age 55 and older have a greater risk. Sex. Some risk factors may affect heart disease risk differently in women than in men. For example, estrogen provides women some protection against heart disease, but diabetes raises the risk of heart disease more in women than men. Race or ethnicity. Certain groups have higher risks than others. African Americans are more likely than whites to have heart disease, while Hispanic Americans are less likely to have it. Some Asian groups, such as East Asians, have lower rates, but South Asians have higher rates. Family history. You have a greater risk if you have a close family member who had heart disease at an early age. Fortunately, there are many things that you can do to reduce your chances of getting heart disease. Number 1. Control your blood pressure. High blood pressure is a major risk factor for heart disease. It is important to get your blood pressure checked regularly, at least once a year for most adults, and more often if you have high blood pressure. Take steps including lifestyle changes to prevent or control high blood pressure. Number 2. Keep your cholesterol and triglyceride levels under control. High levels of cholesterol can clog your arteries and raise your risk of coronary artery disease and heart attack. Lifestyle changes and medicines can lower your cholesterol. Triglycerides are another type of fat in the blood. High levels of triglycerides may also raise the risk of coronary artery disease, especially in women. Number 3. Stay at a healthy weight. Being overweight or having obesity can increase your risk for heart disease. This is mostly because they are linked to other heart disease risk factors, including high blood cholesterol and triglyceride levels, high blood pressure, and diabetes. Controlling your weight can lower these risks. Number 4. Eat a healthy diet. Try to limit saturated fats, foods high in sodium, and added sugars. Eat plenty of fresh fruits, vegetables, and whole grains. Make smart choices like limiting refined carbohydrates, processed meats, and sweetened drinks. Use the nutrition facts label on packaged foods to cut back on sodium, added sugar, and saturated fats, and avoid trans fat. The DASH diet is an example of an eating plan that can help you to lower your blood pressure and cholesterol. 2 things that can lower your risk of heart disease. Number 5. Get regular exercise. Exercise has many benefits, including strengthening your heart and improving your circulation. It can also help maintain a healthy weight and lower cholesterol and blood pressure. All of these can lower your risk of heart disease. Number 6. Limit alcohol. Drinking too much alcohol can raise your blood pressure. It also adds extra calories, which may cause weight gain. Both of those raise your risk of heart disease. Men should have no more than 2 alcoholic drinks per day, and women should have no more than 1. Number 7. Don't smoke. Cigarette smoking raises your blood pressure and puts you at higher risk for heart attack and stroke. If you do not smoke, do not start. If you do smoke, quitting will lower your risk for heart disease. There's no such thing as a safe tobacco product. If quitting smoking or tobacco is a challenge for you, ask your team to help you to kick the habit using proven methods. You can talk with your healthcare provider for help in finding the best way for you to quit. Don't just swap one tobacco source for another, and try to avoid secondhand smoking too. Number 8. Manage stress. Stress is linked to heart disease in many ways. It can raise your blood pressure. Extreme stress can be a trigger for a heart attack. Also, some common ways of coping with stress, such as overeating, heavy drinking, and smoking, are bad for your heart. Some ways to help you manage your stress include exercise, listening to music, focusing on something calm or peaceful, and meditating. Number 9. Manage diabetes and other conditions. If you have high blood pressure, aka hypertension, high cholesterol, high blood sugar, diabetes, or other conditions that put you at greater risk, it's very important to work with your healthcare team and make lifestyle changes. Many conditions can be prevented or managed by eating better, getting active, losing weight, and quitting tobacco. Having diabetes doubles your risk of diabetic heart disease. That is because over time, high blood sugar from diabetes can damage your blood vessels and the nerves that control your heart and blood vessels. So it is important to get tested for diabetes, and if you have it, to keep it under control. Number 10, make sure that you get enough sleep. If you don't get enough sleep, you raise your risk of high blood pressure, obesity, and diabetes. Those three things can raise your risk for heart disease. Most adults need 7 to 9 hours of sleep per night. Make sure that you have good sleep habits. If you have frequent sleep problems, contact your healthcare provider. One problem, sleep apnea, causes people to briefly stop breathing many times during sleep. This interferes with your ability to get a good rest and can raise your risk of heart disease. If you think you might have it, ask your doctor about having a sleep study. And if you do have sleep apnea, then make sure that you get your treatment for it. Number 11, take your medicine. If you have a health condition, your doctor may prescribe statins or other medications to help control cholesterol, blood pressure, and blood sugar. Take all medications as directed, but don't take aspirin as a preventive measure unless your doctor tells you to. If you've never had a heart attack or stroke, a daily aspirin may not help you at all and could cause problems, including risk of bleeding. If you've had a heart attack or stroke, your doctor may want you to take a low dose of aspirin to reduce your risk of having another. Number 12, be a team player. Your healthcare team can help you reduce your risk of heart disease or stroke to live a longer, healthier life. Work together on your prevention plan. Ask questions and be open about any challenges you may face in trying to make healthier changes. Stress, sleep, mental health, family situations, tobacco use, food access, social support, and other issues all can affect your health and well-being. Live well today for a healthier tomorrow. The bottom line, healthy living is the best way to delay or avoid many heart and brain diseases. This means being active and fit, eating healthy, avoiding tobacco, and managing conditions that can put you at greater risk. Take charge of your health.